question I get asked a lot is, what's the difference between a psychiatrist and a psychologist? Because both of them are health professionals that focus on treating people with mental health problems. The key difference is that a psychiatrist, such as myself, has trained firstly as a medical doctor and then has trained as a specialist in mental health. And so that allows us to think about the integration between somebody's physical and mental health. It allows us to make diagnoses that fit with that interaction, and crucially, it means that we're able to prescribe medication and order physical tests. A psychologist doesn't have that background in medicine, but what they have is a huge expertise around some of the talking therapies that are used. Very often, as a patient, you will end up seeing both a psychiatrist and a psychologist. The psychiatrist will focus more on understanding the disorder and in thinking about what medications can help, while the psychologist will focus on some of the talking therapies. Once you have an appointment time to see a psychiatrist, the question is then how one should prepare for that. Sometimes psychiatrists may ask you to fill out some questionnaires before your first appointment. They might be online questionnaires or paper questionnaires. That is just to help the psychiatrist understand the type of issues that you're likely to want to be discussing, and sometimes also to help you think about what is most important for you. In terms of other things to do in preparing for the appointment, it is really useful if patients can have a think about what are the key issues they want to be discussing, and also importantly, what are the key things that they want to have as goals from the treatment, so that that is clear in their mind before they come in. From a more practical point of view, gathering the names of medications you've been on before or the boxes of medications you're currently on, previous reports, that type of background information can really help with the first assessment. My top 4 tips for recovery are, firstly, to find a clinician that you trust and that is able to give you best quality evidence-based treatments for your symptoms. The second thing is for you and your clinician to agree a set of realistic treatment goals. There's no point you and your clinician just meeting regularly and not working towards clear things that you want to achieve. The third thing is, it's very unlikely that there's going to be one magic treatment that gets you better. It is likely that you're going to need a combination of things. Medication, talking therapy, exercise, it'll differ for each person, but if you can focus on the fact you're going to need lots of different things and bring them together, then that will help in your recovery. Lastly, you have to get the right support team around you as part of that. Part of that support team will be your psychiatrist and your psychologist, but there will be other people like your case manager and your GP who need to be involved, and also people that are important to you in terms of supporting you in your life, your family, your friends and other people. And having that team around you is crucial for your recovery.